Hello, my name is Keosha Taylor, and yes, I currently do work in mental health. When describing my past experiences with mental health or a way that it has affected me in a personal way, someone personal to me, I had a family member, one of my cousins, about 2 years ago. She had a mental break. She was at home, and all of a sudden, she just started feeling like someone in the house was watching her. She got very paranoid. She felt like there were cameras in the house. She said she had been dreaming that someone was trying to kill her and her children, so she was very paranoid, and she just didn't want anyone to come in the house. She had all the doors locked. She was scared to come outside, and then she started getting physical and aggressive with her husband. In the beginning, we took her to a hospital setting and they discharged her right away. We didn't actually take her, her mother took her and her husband. So then the mom called me because she knew at the time I had been working in mental health. I went over there to see my cousin. It was so sad. She was very paranoid. She didn't want anybody to talk to her, not her husband, not her mom. She said that she felt like I was the only person that she could trust. So I asked her if she was willing to go with me to another psych facility. And I did. I took her to Tucker's, which is one of the hospitals that is connected to Chester, Chippenham Hospital in Richmond. She went there. She was admitted and she got treatment. She was diagnosed with schizophrenia and paranoid schizophrenia, and she got on her medication. If she was reluctant, she didn't want to take it in the beginning. I started talking to her, convincing her how important it was if she wanted to get home to her kids and be safe. So she did start taking it. She got better. She came home, and we found out that it was actually due to a substance. She had been smoking the marijuana that is like synthetic, and she wasn't actually smoking it. As a matter of fact, it was the edibles, those like the little nerve candies, and I finally found out that they had been eating those the night before. So when she did eat that, it did cause her to have a type of imbalance, and it did mess with her mentally. So she actually was one of the blessed people who didn't have to continue to take the medicine. It did wear out of her system, and she was okay after about 2 months. I still check on her a lot though, just to make sure she's okay, and she doesn't use any substances at all. Um, I love her so much, and I'm just so glad that she got better, because mental health is a very serious field of healthcare, and they need very special people to work with them, the patients, so that they can get to a better place. Some of the reasons I chose to work with this population is when I did my RN clinicals, I fell in love with psych. I was always scared of psych prior to that. I thought it was just dangerous and scary. And then I started coming in and I seen kids that were battling mental illnesses that had some stories that were so touching. And I just automatically just draw to it. So at that point, I started to want to work in mental health, and that brought me to the job that I'm at now. Some of my concerns regarding clinicals, and I don't really have too many. My clinicals is through another partnership with my job. I currently work at Poplar Springs Hospital, and I'll be going to one of their branched out buildings. It's called Branches in Chester, and they see patients more outpatient, so it's not an inpatient setting. And I'm just so excited to work with patients of all different types of populations, and I can't wait. One of the biggest things I want to work on academically and professionally with this clinical is my rapport with patients. I feel like I have a good rapport with most of the patients I work with, but and on a therapeutic level and like with social workers and case managers and clinicians, it's a different type of understanding of the patient, a different type of communication. So I'm hoping that this clinical allows me to gain more communication skills so that I'm able to be a great nurse practitioner in the future, because I do hope to one day open my own practice and be able to work with adolescent mental health patients as well as adults. But I am targeting the adolescent population because I love working with kids, and I just feel like if you can help them when they're young, you can help them have a better future, because of course the children are our future. And I hope that I was able to answer every question that was part of this journal thoroughly, so that you understand exactly where I'm coming from. Like I said, I love mental health. I love kids. I love the adult population as well. But like I said, the kids are so dear to me because I feel like if it is not for us helping them when they're young, then a lot of them don't have to worry about coming into these type of places when they're adults. They can actually have positive futures. They have good role models and a good healthcare team. Thank you.